Hi, Mom, seriously, I'm trying to make a video. Can you give me 1 minute? Let's try this again. Hi, and welcome to the Springhill Equine Seminar. If you're new, like me, don't worry, it's gonna be fun. We'll give everyone a chance to grab some food and get comfy, and then we'll get started. Mom, I'm working here. You're always embarrassing me. Okay, I think we're about ready to go.
All right, the man in charge says I'm live. So, I want to welcome everyone to our lameness seminar tonight, in person and in Facebook, YouTube land. If you've got questions out there as we go through, feel free to drop them down below and we will get them asked into the seminar tonight. So don't feel left out there. Don't feel left out there. You guys obviously can jump up and down and shout, no problem. A couple of housekeeping things. We have, I already forgot the dates from there to here. We have 2 seminars coming up as well. So May 19th, we have a seminar we're doing with the Cooperative Extension Service. They've opened their brand new facility just a few miles from us. Many people don't know all of the amazingness that the Cooperative Extension Service offers. I highly recommend you listen to this, especially if you live in the United States. Like, this applies to the entire United States, not just Alachua County. It applies to every county in the United States. There's a cooperative extension agent that is there to help you make your horse pastures better, make your cows grow bigger and fatter, make your garden look better. You name it, if it is remotely involved with agriculture, those guys are there to help you out. And I mean remotely involved with agriculture. They have a wide variety of services that most people don't know they offer. So tune into that seminar. Again, that's May 19th. June 16th, we sort of have an adjunct seminar to tonight's lameness seminar. We'll be touching on feet tonight, but Dr. Staples will be doing lameness of the feet on June 16th. She couldn't do it tonight because she decided that she was going to the Kentucky 3-day event instead, which we're just a little jealous. So bear with us as we cope with our jealousy. So anyway, look for those 2 things coming up soon. And again, you guys ask questions, and we'll be good to go. And I will turn it over to Dr. York for part 1.
Hey guys, thank you very much for coming out tonight to talk about lameness. This is one of my very favorite topics. I really enjoy doing lameness exams, really like to involve clients and have you guys understand a little bit about what we do also when we look at your horse for lameness. So it's bread and butter of what we do here at Springhill Equine. We do a lot of lameness work. And you guys probably understand that all of your horses are athletes, right? For whatever we want to do with them, whether they're a high-level jumper, a dressage horse, just a trail horse, or even your backyard horse, they have a job to do. And the happier they are, the more comfortable they are doing that job, being sound and comfortable doing it, the happier you are, the more you can do with your horse. So it's really important for you to understand what to look for in terms of lameness, and then also if something comes up, how we're going to deal with it at Springhill Equine. So a lameness exam isn't exactly the same every time we do it. It'll depend on the circumstance, but there are several pieces of the lameness puzzle we put together And during a lameness exam, you may see some of them, you may see all of them, but I want to go through the basics of how we do this so that when it's time for your horse to need a lameness exam, you'll understand a little bit of what's going on. So the first thing we'll go into is how to see a lameness, how to observe lameness when you're watching your horse walk and trot, and what we'll do when we see your horse here at the clinic. And then once we've determined if the horse is lame and what leg it's lame on, where do we go from there to determine the part of the horse's leg and the problem specifically? So we'll go through what we do in terms of feeling for abnormalities, looking for abnormalities on your horse's leg in terms of his conformation and symmetry and swellings and things like that. And then other things you may see is the hoof tester exam. It's an exam we'll talk a little bit more about, but basically helps to differentiate sites of pain in the horse's hoof. And then we'll talk about some flexion tests and nerve blocks that we'll do to decide where specifically your horse hurts. So when we watch a lameness, we're going to mostly be looking at the walk and the trot. There are some things we do with the canter, and we certainly want to hear from you if you have problems with your horse cantering at home. But most of what we do here at the clinic is at the walk and the trot. And we'll start out typically on a straight line. Watch the horse trot and walk in hand, usually not with a rider on. There's some circumstances where we do that, but usually just here in the grass side of our clinic here, we'll watch your horse move. We'll watch from front, we'll watch from behind, and we'll watch from the side often. And you may notice, and you may have been involved in this if you've been the one jogging your horse for lameness, we like to have the horse's head a little bit free so that we can watch for head motion. Okay, so when our technicians are jogging our horses, we'll get your horse trotting, and we like to then be a little free with the horse's head because that's going to be a big part of how we look for lameness. So once we watched your horse on the straight line, we're going to be looking at him in circles. That's often on a lunge line if your horse knows how to lunge, and sometimes it's our wonderful technicians jogging in circles with your horse. We may look at your horse on a hard ground. We may look at your horse on a softer ground like sand or like a softer grass. Do you guys have any idea why we might want to look at both different ways? So hard ground might bring out a bone type pain like arthritis or foot pain. They're often more sore when they're on hard surface, and a soft surface can accentuate a tendon or ligament type of injury. So a deep sand surface would make, let's say, a suspensory ligament injury feel a little worse to the horse so we can see it better and help diagnose it. So before we go on to look at some examples of this, I want to take a moment because this is something I hear a lot, and I think it's a big misunderstanding that some people have about their horses. I hear a lot, oh, my horse, he's such a faker. He isn't really lame, but he only pulls out a lameness when I go to get on him and ride him. He's such a joker. You know, he's fine when I watch him cantering across the field. And here's the thing. Horses don't have the mental processing available to lie to you. What they tell us is the truth. There are certain circumstances that make a lameness look worse, which may make it look like he's faking it. So when he goes galloping across the field, he may have more motivation or less rider weight or be traveling in a straight line, things that make him not look so sore. And so you don't really think there's a problem. But then when you go to get on him, you go to trot him, you put him in a circle, you'll see that head bob lameness come out. So horses don't lie. If you're seeing it when you're on him, he's also lame all the time. You just accentuate it with certain things more than others. And then also another point is that stiff and choppy can be a sign of a lameness in both front feet, for example, or both hind feet. So just because he's stiff and choppy, we would also consider that in the realm of lameness, and it would take a little bit of differentiation to figure out what's going on with it. Okay, so we're going to talk about forelimb lameness first. And I've got a little video that's going to play here. So forelimb lameness, generally simpler to look at than hindlimb lameness. The big thing, the most obvious thing we're going to look at is the head bob. Okay, so, and the way I think about it is down on sound. So watch this horse trot here. Okay, you see the head bob as he's trotting. Now what I do is I find the head bob, and then I look to see what leg is hitting the ground when the head bob's down. So if the left front is hitting the ground when the head bob's down, it's down on sound, down on the left, so he's got a right front lameness. So down on sound means the other one is the lame leg. So this video in Facebook land, you may have the audio on this video. I'm not sure. I know in real life we don't hear. One thing you also want to look for or listen for is the sound that a horse's hooves are making. So if he's going, he's going to impact less strongly with the sound or the lame leg and stronger with the sound leg. Okay, so when he bobs down, he's going to hit the ground harder with the sound leg. So listen for that too, especially on a hard surface. As we just mentioned a minute ago, if both front legs hurt, it can look even when, especially if you're going in a straight line. It's not necessarily that you're going to see a big head bob. You may see a short stride, a hurried rhythm, loss of balance. And then when you put that horse on a circle, you may see the head bob come out one direction versus the other. You also may see the whole body stiff, and instead of bending in the nice direction that the circle's going, you may see him counter bending and almost looking outside of the circle, and that's a sign of stiffness. It doesn't necessarily have to mean forelimbs. It can mean stiffness somewhere else, but forelimbs is a common reason too. Okay. Another point with forelimb lameness is that a lot of it is in the hoof. Not all of it. There's certainly things that can happen higher up the limb too. But about 80–90% of the lameness we see in the forelimbs is in the hoof. So the hoof is one of the first places we look. We do hear a lot of complaints of people thinking their horse has a shoulder lameness. While it's not impossible, shoulder lameness is actually really, really uncommon in a horse. Foot pain can make it look like shoulder pain. So what we see interpreted as shoulder pain, there's a reason why we're going to immediately look at your horse's foot when we hear that. Not that we're discounting the fact that it might be shoulder, it might, but it's rare. So we'll obviously start with the foot and make sure that's not the issue. We talked about the circles before. The lameness is often going to look worse in a forelimb when that forelimb that's the more painful one is on the inside of the circle. So let's say if you have a right front lameness and you're trotting around the circle to the right, that puts extra weight on the right front leg. It's going to make him look more lame than if he was traveling straight or circling to the left. Now, that's not always the case, and about 20% of the time, it's the opposite. So here's another example I'd like to go through. This is about a minute-long video here, and it's going to show you different ways of looking at this horse from the front, from the side, from behind, and then in a circle. So let's watch this horse, and look at its head first. Once you get the rhythm of down, 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 you see a head bob, first of all. That horse's head isn't straight as he's traveling. These are nice videos University of Guelph put together a few years ago with some lameness examples you can find if you want to see some more after this. So I see a head bob on that horse. We're on a hard surface, right? So we'll compare this to later on when we're in the circle in the sand arena. Okay, so what leg is hitting the ground when the head bobs down? So watch it go down. What I often do is say down, down. Yeah, you got it. Down. So I get the rhythm and I say down, and then I look and see it's hitting down every time the left front hits the ground, which would mean it's which lameness? You got it. Right front lameness. Excellent. Okay. So we'll see mostly turning in this direction on this video here in the circle. And that horse looks pretty uncomfortable to me, very unbalanced looking in the circle in this direction. We don't see a lot of the other direction, but I think it might be worse because it's a right front lameness, and usually that would be worse on the other direction. Oh, there we go. Okay. Another video here. This one we're not even going to trot. This is a short video, just a walk and down and back. And this is one of those lamenesses that looks really stiff, right? Watch this pony kind of come around. There's not always an obvious head bob every time he takes a step, but there's a lot of stiffness and kind of like a stilted pattern. He's maybe stretched back a little bit. Obviously, this is, prior to doing any diagnosis, but this looks a lot like a pony that has both front feet that hurt. In this case, it would be laminitis. So Highland lameness gets a little bit more complicated and a little bit more subtle. All right, so we don't have the obvious big head bob, something like that to look at. What we're going to look at is the horse's hind end. And you can see in the picture I have here, you're looking at the horse straight from behind. And I think about the pelvis as kind of like a box here. So when I watch the horse's hind end moving, when he's moving away from me, I want to see a symmetrical movement If, like, let's say my elbows are his hips, I want to see symmetrical movement side to side. And what I'm saying here about increased hip motion and increased hip hike is it would take away that symmetry of that pelvis, and you might see one side going higher than the other, or you might see one side moving more. Other things, if we watch the horse from the side, we might see a shortened stride or him dragging one toe or both toes. And the back pain I have mentioned here isn't always an indicator of hind limb pain, but it often is seen secondary to chronic hind limb lameness. So if your horse is having some back pain, one of the things we might want to look at is there a hind limb lameness that hasn't been notated yet? Bilateral hind limb lameness, similar to a bilateral forelimb lameness, and bilateral just means both sides, so left and right hind. Often you could see a short stride, you can see stiffness, lack of impulsion, lack of momentum, lack of ability to get that good jump or that good trot or canter anymore. And then sometimes if it's bad enough, they almost bunny hop. So like they kind of hop up and down with the hind end, especially going into the canter, compared to just reaching forward freely with both legs. You can have what looks like a front limb lameness and a hind limb lameness. And while that can be real, while you can have two different lamenesses for sure on a horse, if you have what looks like the lameness is on both the front and the hind of the same side, the site of pain is often coming from the hind limb, and they're throwing their body forward in a way that makes it look like that head bob, that forelimb lameness. So when we do a lameness exam, we'll want to differentiate, is that head bob really coming from the hind instead of actually being a real front limb lameness and a real hind limb lameness? So here's an example of a hind limb. We're going to look at two hind limb lamenesses, and these are more subtle, okay? On this horse, we have some tape to the top of that horse's butt. So I want you to look closely, and I'll loop this video so you can watch it a couple times. Watch that tape, and this is a left hind lameness, and I want you to watch the left side of that horse's pelvis. It's traveling up higher and has overall more motion than the right-hand side of that horse. We'll watch it one more time, and then we'll watch another example of a hind limb lameness. So that white tape marker does make it a little easier to just make it stand out where you can see the pelvic motion. Okay, and this is another left hind lameness, actually. So watch, we're going to see this horse again in a minute, but watch this horse and watch his left side of his pelvis. You can see it rises up higher, and it just has more motion overall on the left side of the hip. All right, remember this guy because we're going to come back to him in a minute. Yeah. We have some questions. Yeah, correct. So the question was about a normal trotting horse should not head bob. And it's a good specification that at the trot, the horse's head is usually pretty still. There can be the occasional motion if he, just has an uneven ground. He may move once or twice. But if he's got a consistent head bob, even if it's subtle, at the trot, that's an abnormality. At the canter, the rhythm of their gait has their head moving up and down, and that's just a natural part of the gait. But at the trot, yeah, they should be pretty steady. I see the bunny hopping often in the canter, and especially in the transition to the canter, and that can be several different things. It could be a certain site of lameness, or it could be both hind limbs. So before we go on into the specific parts of the lameness exam, I want to just briefly touch in the anatomy. And I promise I'm not being rude with this picture here, but it shows really well the bones of the horse's forelimb compared to the bones of your hand. And it's kind of amazing that they're standing on your little tiny bone at the very end of your middle finger. That's their coffin bone. Their big cannon bone, that big strong bone in the lower leg of the horse, is this bone right here in you. And what we call the horse's knee in the front limb is actually your wrist. So it's not a knee at all. The real knee is back in the hind limb. That's the stifle. But so when we go into trying to determine what's going on with your horse, we have to have a really deep understanding of the anatomy and know what can happen in those specific joints, specific tendons, things like that. So there's a lot going on, especially in the lower limb here. Sorry, I'll play that. So a lot of joints, we have the navicular bone here, we've got the coffin bone, this is the deep digital flexor tendon coming all the way down here, and there's smaller ligaments all in here. Coffin joint seen in this image in the green, and pastern joint here. And then in red in this little loop video, that's the navicular bursa. So there's a lot of different anatomical areas that can cause a horse problems. So we have to really understand what's going on in there in order to determine what the rest of our exam means. Okay, so we're not going to delve deep into feet today because, like Dr. Letcher said, Dr. Staples is going to do an entire seminar on that, which is awesome because feet are super important. No hoof, no horse, right? But when we're doing a lameness exam, we're always going to look at your horse's trimming, his shoeing, the conformation of his foot, and little clues that we can get about what might be going on based on how those feet are growing. And then also the conformation of the horse further up too. So for example, this picture in the middle with that black leg, do you think that's a normal shape of a horse's leg? No. So that's a specific disease process. That's a suspensory ligament degeneration process. So we'll be looking for conformational things, obvious like that, or more subtle. We'll also be looking at things like this horse on the far left of the screen, the gray horse. That horse has a very low heel, an underrun heel, a long toe, and that tends to cause certain types of lameness issues. So we'll be looking for things like that. The other gray horse in the middle there, do you notice the little rings on his hoof? And that's another signal for us, ooh, we should be thinking about laminitis, for example. And then looking for swellings, looking for heat, looking for anything that doesn't feel like it should when we run our hands down your horse's leg. Okay, so we have our hoof tester exam. And what the hoof tester exam does, it takes this metal instrument and it squeezes specific areas of your horse's foot to determine where your horse has pain. So as I'm doing the video on the right side of the screen here, you see I'm going around the horse's sole, looking for that horse to flinch or to pull back if I press a spot that hurts. And then I'll go back to the heels and I'll look at across the heels. And it's not just randomly pressing, it's pressing where certain anatomical spots are. So if I press where I would be squeezing the navicular bone, I might get a certain response. If I press where the tip of the coffin bone is, where there might be laminitis, I might get a certain response. And so that can be a little clue in terms of looking for hoof lameness. And then we often do a flexion test. And what a flexion test is, we'll take a specific joint as isolated as we can, and we'll hold that joint and kind of squeeze it in flexion for 30 seconds, 45 seconds or so. And what we're looking for here is to make a horse that really wasn't showing a lot of lameness or not very overt lameness and accentuate that lameness or make lameness appear where he wasn't really showing it before. So a positive flexion test increases the lameness or shows us lameness because a certain joint is really the problem, but it only was obvious when we squeezed on it like that. So the next video here is that same paint horse we watched. That was the left hind lameness. Okay, so this is the one we watched before. Look for that increased motion of the pelvis on the left-hand side. And then the next video is that same horse with the flexion test. So watch as I flex that horse's fetlock. You can see the lameness is much more apparent now, right? So putting that extra little stress on the horse's fetlock showed us that there's a site of interest here we need to go and further evaluate and do x-rays on. That horse ended up with a sesamoid fracture. So the last part of my section here, do you have a question?
Well, I just wondered,
yeah.
When you did the flexion, will the flexion draw out or amplify lameness that's in the hoof or lameness that's in the joint or both?
It's more joint. There is a specific type of flexion. It's actually an extension that I can do to amplify a little bit of a heel pain in the foot. more often than not, what we're trying to do is the joint specifically. So that fetlock joint one will also put a little pressure on the coffin joint and the pastern joint. So we call that a distal limb flexion. You can do a hock flexion, a stifle flexion, that sort of thing. Yeah. So the last part of the lameness exam that we'll discuss before we get on to how to image how to determine what's actually going on is called diagnostic analgesia. And we usually refer to that as nerve blocks or joint blocks. And the idea of that is that we're temporarily going to numb a certain part of the limb so that if that's the part that hurts, the pain goes away. And we're talking for like an hour or two. We're not talking like months. It's just like when you go to the dentist and you have Novocaine to get a cavity, it's that. So if we have a horse that's lame and we put the nerve block in and then the horse moves off a lot better, we can tell that we numbed the specific spot that was the one that hurt. And we can go ahead and then take an x-ray of it or an ultrasound of it. So in order to do this, we do need a horse that has enough lameness and a consistent lameness that we can tell when we've made it better. If we have a horse that sometimes looks lame and sometimes doesn't, it's hard to tell whether that block actually improved things. So if you have a consistent lameness, it can be subtle, but consistent, we can numb that out and then tell that that's the site of interest. Typically, we're doing nerve blocks where we just put a needle in right beside the nerve, but we can also do a sterile procedure numbing the joint itself or the tendon sheath itself, and that's going right into that synovial structure. So that's a lot more sterile of a procedure than just your typical nerve block. But so in a typical nerve block, what we're doing, you can see on the left side of the screen, we have an arrow pointed to the palmar digital nerve. So this nerve right here supplies the foot. So if I want to check to see if the lameness is coming from the heel or the sole of this horse, I could put in this block right here. You can see in the middle with that blue needle hub, put a couple mils of the numbing agent right there. And then if that horse trots better, I know this here is the spot that I'm interested in terms of x-rays. If the horse doesn't get better, that also rules out that spot. And it tells me, well, I'm going to go up. Yeah, so I'm gonna. So if I do that block I just described, where it numbs the heel and that didn't change, I might go up to one just at the level of the fetlock and see if that changes it. If that doesn't change it, well, I might do this block here I have on the right side, where I've got 2 needles on this side. There would also be 2 needles on the other side, and that would numb everything from just about that level of that fetlock down. So wherever it changes is where I know the lameness is. So we go from watching the horse to determine what leg it is and try to look for clues on what part of the leg. And then we kind of isolate down where the specific site of lameness is. So at that point, that's the conclusion of my section. And we would go on to Dr. Abbott's section about how to do the imaging and determine this information. Where do we go from there? So let's take a couple questions real quick. Can't make a diagnosis we're comfortable with for treatment. So, yeah, inconsistent. So sometimes it helps if you've come in, let's say that horse is not showing enough lameness on that day to determine what's going on. We may try to do some things to accentuate the lameness, like the flexion test. Sometimes moving a horse in like downhill will actually bring out a forelimb lameness. We could do things to try to make it a little worse. Sometimes you take the horse home and you bring it back on a day that he's showing more lameness. You're right in that if we don't know exactly what the problem is, we don't get a really good sense of how we're going to treat it. We don't like generally to shoot from the hip and just, one size fits all kind of treatment. We really want to know what's going on with your horse in order to offer you the most effective treatment. So waiting for it to show a little bit more severe of a lameness where we can determine what's going on would be where I'd go from there. Okay, so at this point, Dr. Abbott's going to come up and take it from here.
I just love this picture. It's like you're riding off into the sunset. Looks great. I'm assuming this is Dr. York on her horse riding off into the sunset. Yeah. So after the lameness exam, after the diagnostic blocks, all of those fun things, we like to do imaging. And imaging is super important because it does help to kind of guide us to what we're going to treat, how we're going to treat, where we're going to treat, and kind of go from there. So, like I said, it's after the exam. And once the lameness is isolated, we can then decide, okay, what are we going to do? Sometimes we'll do this before we do the diagnostic blocks. And this is because when we put in fluid in or around a tendon or a ligament or a joint or anywhere, it can actually cause a false lesion. It can actually make it look like there might be something wrong that isn't actually wrong. So sometimes you might kind of see us veer off the normal path, and we get to do that because that's what we do. And say, okay, we want to ultrasound this first before we block it to see if it gives us any more information. Most of the time we do it after we block things though. So one of the things you'll see us pull out all the time is our x-ray equipment or a radiograph machine. It's really, really great for diagnosing problems with bone. Sometimes you can see some soft tissue swelling. You can see some edema and whatnot on an x-ray, but that's not quite as specific. It's pretty cost effective. It's very easy for us to use. It's very portable. We can throw it on the truck, pull it out our equipment, wireless, battery operated. It's super great. But it is only, it takes a three-dimensional object of your horse's leg, your horse's foot, your horse's back, whatever, neck, and makes it a two-dimensional kind of image. So it doesn't always tell us exactly where within the limb the problem is. So for example, you might think that these little lesions right here are right on the front of that horse's fetlock, but in reality, they could be kind of to the side. They could be, to the outside of the leg, to the inside of the leg. They could be kind of anywhere. So it's super important that when we're taking x-rays that we don't just take one image. We like to take multiples so that we get a better idea of where on this horse the problem is. This is just a really, really good example of a laminitic horse, one that has had rotation, maybe some sinking, as you can see here with the line right here. And this gives us a lot of information as well as far as what are we going to do as far as treating this horse? What kind of shoe are we going to have Dr. Staples put on this horse, or your farrier? But what are we going to do to help this horse be more comfortable and get better? So like I said, it's a 2D thing of a 3D object. It's a 2D picture of a 3D object, which makes it not always 100%. The other thing about radiographs is that if there's a fracture or there's a new lesion, that we may not see it right away. Sometimes you have to go back in a few days and re-X-ray, and then things might show up. So we may not always get an answer right away. Ultrasound is also one of those things that we're going to pull out when we're doing a lameness exam. We love our ultrasounds. It gives us so much information. But again, this is one of those things that if we're doing blocks, we may not want to ultrasound that same day. We may say, look, we need to come back tomorrow, or we need to come back in a couple of days to do this ultrasound because we've blocked your horse and now there's fluid around and we can't get a great image of what we need to see. But we use our ultrasound for our soft tissue. We use it for tendons and ligaments. You're going to see us pull it out if we've blocked your horse to a lower limb, that low 4-point block that Dr. York was talking about, would be great to let us know if we have a suspensory branches that are bothering your horse, or sometimes we'll even work our way up and do a higher block, and that would give us information of a suspensory lesion. Sometimes it's even just the basic exam that we do. You'll see that there's a profile on the back of the leg, and that will tell us, we need to look at the deep digital flexor tendon and the superficial digital flexor tendon, because maybe they have a bow tendon. So ultrasound is great because we can look at everything in two directions. So this is kind of our cross section of a limb. This is the left front limb, and you can see nice, smooth, normal fiber patterns, kind of nice, even of the superficial and the deep digital flexor tendons. You don't see anywhere where there's a big black hole or anything like that. And then when we go over to the right, you see right in the middle here, it's got a nice little hole in it. So this is what we would call a core lesion. So it's very nice because we can also, when we're doing ultrasounds, compare and say, okay, is this normal for this horse on this right front leg? Is it also on the left front leg? It might be, in which case it might be normal. And so it's great that we get to be able to use both of these. The other good thing about ultrasound is that we can look at it in another direction. So if we're looking at a cross section, then we can also look at it in the direction in which it runs. And it will also tell us, okay, yeah, see, there's disruption of this fiber pattern here. This looks really messy, whereas this is nice and straight and tight. So we can, pretty confidently say this is a real lesion, and this is probably why this horse is lame on this right front leg. The other thing that we can look at is we can look at joints. You'll see us pull this out all the time for stifles. We love to ultrasound stifles. It ends up being safer for us to ultrasound stifles. Horses don't hate it as much as they hate that giant x-ray plate going up in between the back legs. So we ultrasound stifles all the time, and we can look at the joint space. So here we have a joint, the medial-femorotibial joint of I'm not sure if that's right or left hind stifle, but we'll go with it's a stifle. And you can see there's this dark fluid is effusion. And when we have effusion, that means there's inflammation. A little bit of effusion is okay, and a little bit of effusion is normal. However, this much effusion, and then if you see kind of this fuzziness around the edges, those are all markers of inflammation. So maybe this horse has been showing at WEC for the last 12 weeks, and it's tired, and it's got, some wear and tear on its joints. Or maybe it has an injury to its stifle itself. Maybe it has this meniscus injury right here. It's not always 100% to know, but if we ultrasound it, we can say, okay, we got to do something, and we got to figure out why this horse is as uncomfortable as he is and why he has this much effusion. It's also good for some bone surface stuff. So on this image, I actually picked this image for multiple reasons. It gives us an idea of what a not pretty meniscus looks like. So see, it has this dark area here. So this meniscus has been injured, whereas this one, you can see it's all solid and beautiful. That's a nice meniscus. But also, this is the bone. Okay, this is our femur. And you can see we're kind of maybe missing a little part of our continuity of our femur here. It doesn't just go in a nice, smooth, straight line. And so this would be like a reason for us to say, okay, we should probably take an x-ray of this, because is this a fracture, or is this just arthritis? What is it? But definitely a reason why this horse would be lame and why he would have effusion, and probably why his meniscus is messed up. Anatomy is super important when ultrasounding. And this is because in some of our tendons and our ligaments, most of them, our muscles, and by our, I mean the horses, but you know what I mean, muscles attach to them. And so they can kind of go into the middle of the ligament, and it can actually make it look like there's a lesion, but in fact, it's just muscle. So as doctors, as veterinarians, we have to know our anatomy, because we could falsely, diagnose something that isn't there because it's just their anatomy. The fun part about ultrasound as well is that when we're ultrasounding limbs, we can get different images and we can get different information because we can lift the leg and we can relax the leg, and it can show us that, when the leg is normal and standing and has all of its weight on it, those tendons and ligaments might be really tight, but you lift it and you kind of take the pressure off, and you might find a little lesion or a little tear in one of those tendons or ligaments. Same with joints. We can flex them and extend them, and it can tell us a lot of information while we have the ultrasound on it. Well, you'll see us pull out ultrasound as well as if we're treating a lesion. This is a lateral, it's a sensory branch of a left hind leg, and you can see right here, this one's got a nice little hole in it. So what we can do is we can then take our ultrasound, find this image, then use it to guide our needle directly to this hole and put in usually PRP, platelet-rich plasma, to help facilitate healing. So that's a really cool thing that we get to do with our ultrasound. When we do ultrasound and we do find a problem, it's one of those things that we really have to follow up on, usually every couple of weeks. 4 to 6 weeks, we like to recheck ultrasounds to make sure that we're going in the right direction, make sure that we see that the fibers are kind of filling in and everything. And if it's not, then it helps to tell us, okay, we need to take more stall rest, or we need to start, or they're looking great. Okay, let's start turnout. Let's start, letting them move around a little bit. So we don't want those tendons and ligaments to get really tight, because then they're going to get short and then we risk tearing them again. So we've got to get them moving some once the ultrasound tells us they can. As far as just kind of a side note for the healing process in horses, it's a fun little kind of, I don't know, trick, if you will. There's a bone injury, like a fracture or something. Bones take about 4 weeks. There's 4 letters in bones. And this is approximate, not all, not the end all be all, but bones take about 4 weeks just to, heal. 4 letters. Tendons, there's 6 letters, 6 weeks. 6 weeks, 6 months. 6 months. 4 months. Sorry, tired. Up with the colicking horse all night, my own. 4 months, 6 months, 8 months for ligaments. So the number of letters in the word is how long it takes in months for it to heal. So kind of with the question that Dr. York answered earlier as well, but if we do all of this and we still don't really have a great answer as to why the horse is lame and where it's lame, then we get to go to really advanced diagnostics, which we don't do here. We don't have the equipment, but we're gonna talk to you seriously about saying, okay, we've done everything that we can possibly do. We can't find the answer. Obviously, your horse is lame. It gets better when we block its foot. It's in the foot, but we can't see why it's in the foot. We're going to say, you got to go to Ocala, where we're going to say, okay, we probably need to do a bone scan or a CT or an MRI. And based off of what we've seen on our exam, what we've seen with our blocks, what we've seen on x-ray and ultrasound, that will kind of guide us on which one we're going to recommend. Whoops, going the wrong way. So a bone scan, they actually often will do the entire horse. So this is one of those where you're like, it's lame, it's sore. We don't know where and we don't know why. So what they do is they actually inject it with a dye that is radioactive. And then they take all these images of the horse and you can see where there's increased bone activity. So even looking at these hocks, you can see this hock here has way more uptake than this hock. So this would be one where we would say, okay, we see this, we need to really look into this hock and why it's taking up this much dye. Same thing kind of, as we go here with this is the hip, and we can't image hips, right? We cannot x-ray hips. So we've worked up the entire leg. We've gotten to stifle. The horse is still lame. So we're going to say, okay, go do a bone scan, because then we're going to be able to see if it's its hip. And it'll tell us, it'll take up more of the dye that they put in them. Not dye, but you know what I mean. And it'll say, okay, it's the right hip. And maybe at that point, we can say, okay, we can inject that. A CT scan, you'll get one when you come here, when you bring your horse here. Tony provides them. He's a fabulous CAT scan, but it's not going to give us the information that we need on why your horse is lame. He's just not, he's good. He's just not that good. So a CAT scan is going to give us bone detail, and that's going to tell us about, things in your horse's. We do often CTs for feet, for necks, sometimes, up the leg a little bit, but and heads. Heads are often what we like to CT because sometimes there's a bone lesion or a tumor or something in the head, in the skull that we can't see. So we'll send you for a CT, and that will give us information on what the bone in that specific area is doing. If a CT is not the right answer, then we go MRI. MRI is going to be for soft tissue. We send horses for MRIs of their feet all the time because we cannot ultrasound feet. We can at least x-ray feet. We cannot ultrasound feet. You can't see in them. You can't, the hoof wall and hoof capsule just doesn't let us. And it's going to let us see soft tissue of the foot. And you can also help to localize a lameness. If there isn't a radiographic or ultrasonic lesion, we can still localize a lesion of a soft tissue lesion with MRI. Just going to go over one quick case with you guys. This one was really interesting, and this is one that we actually used 2 different of our imaging modalities. It was a yearling quarter horse filly who flipped over the fence the night before, and she was sore. She wasn't too bad that night. The next day she was sore, didn't really want to lift her head up, kind of just protecting her neck a lot. There's pain when we palpated on her neck, particularly kind of up near her ears, but she really didn't have a lot of swelling. So I'm like, okay, we should probably take an x-ray of that and see what we see. So because we only got a 2D image with our x-ray, you can see that it looks like maybe there's something right here, but she's a yearling. How can we be sure? You know, her growth plates aren't all fused like they're supposed to be. So, okay, maybe there's something there. But to know for sure, she should probably have a CT. So we sent her down to get a CT of her neck, and it confirmed our diagnosis. So you can see here a nice fracture in the bone, and you can see here a nice fracture in the bone. So she's actually doing pretty well. She's at home, she's on stall rest, and she's healing. She had no neurologic deficits. She was able to walk around normally. She's eating and all that. She's going to take a little time to heal, but she's actually doing okay. So this is a really cool example of how we can use both of those imaging modalities to get a more concrete answer and kind of direct our treatment and all of that. So I think now Dr. Latcher is going to take over and going to the treating of the lamenesses.
First, Dr. Latcher is going to turn on her microphone. Okay. So we have a couple questions that we're going to address really quickly. So why does a nerve block not need to be sterile like joint injections? It does for certain places. So when we're doing like the low one that Dr. York had on the image where we were just putting the needle down low on the foot, we're not near a tendon sheath or a joint structure. So for those, we can get away with a lot. We do still clean the area. We just don't necessarily do it 100% sterile. If we're going near anywhere where we're worried about doing a joint sheath or a tendon sheath or a joint, then we absolutely do them 100% sterile. Like you'll see us do a joint injection, which we're going to talk about here in a moment. But the other benefit we have to our blocking agents is they're actually antibacterial. So the good news is that the horse is very excited they're antibacterial. So because they're antibacterial, we don't have to worry about it quite as much as we do with some of the things that we're going to put in joints that we're going to talk about. Can a horse be too old for nerve blocks? No. I blocked a 30-year-old last week. Diagnostics on non-weight-bearing horses can be really tricky. And step one is our eyeballs, because we look to see, is there something obvious that is very swollen, very tender? If there's something where the horse is telling us that this is a big issue, we're going to go straight to our imaging from there. We're not going to worry about blocking. We're just going to go straight to, can we ultrasound or x-ray this spot? The big problem with non-weight-bearing lamenesses is they are often way high up in the body. They're hip, back, areas that are very difficult for us to image. And so sometimes we're left with, let's see what we can try and figure out. Let's try to rule out fractures. And one of the ways that we do that is that the horse should be what we have an intact bony column. This doesn't 100% rule out fractures, but it gives us a good idea. If we can get that horse to stand on that leg, then we have an intact bony column for the most part. We're less worried about catastrophic fractures. They can still happen, but we're less worried that that's what we're looking at. But we're just going to start. Merlin has a lot to say about everything. So we're just going to start trying to manage pain to see if we can get this horse through this episode while we're trying to figure out how can we see what we have going on. And it usually takes a lot of diagnostic capabilities. But sometimes we don't want to send those horses to, for instance, a bone scan right then. They're just too painful for us to want to put them on a trailer. So we may give them a few days to get over the worst of the pain, and then we move on to more advanced diagnostics. What are you looking for? Okay to be turned out or back to work? We're not going to talk about what I do to give them the okay to get turned out or back to work yet, because we're not there yet. We haven't treated it. So let's talk about treating lameness. And to be honest, this is kind of an exciting area for us as veterinarians. This is where we get to get into some really cool sciencey stuff. So I love discussing the treating part of things. So So we've diagnosed a lameness, and let's say, for instance, that we have diagnosed a joint as having an issue in it. What we would commonly do in the past is we would put a steroid in there because we knew that there was inflammation going on in that joint. Steroids come with their own set of problems, though. They don't cause healing. All they do is shut down inflammation. And while that's good, we're only taking care of one side of the equation. There's a healing side of the equation that needs to be done as well. They can also be long-term a little bit detrimental to joints, so we were always very careful with putting them in. The other problem that we have with steroids is that they have a rare but really bad side effect of just because we put the steroid in a joint doesn't mean that it doesn't hit the system, and we can sometimes cause laminitis, especially in our overweight friends. Yes. And no one here has an overweight horse. I certainly don't have an overweight horse that I was called out upon by our technicians. Yeah, that would never happen. So while steroids are great and they have their place, we had some problems with them that needed to be overcome. So enter the world of biologics. And biologics are all the cool things that you hear about on the news. So they're stem cells, they're platelet-rich plasma, they're, anti-cytokine factor this and interleukin that, and they have all these really fancy names. The trick to biologics is just because you make it doesn't mean it actually has in it what it says it's going to, or that it does what it says it's going to. So relying on your veterinarian and not the trainer that you saw advertised in Practical Horseman as using some product is a much better way to determine which biologic is appropriate to your horse than the faceplace. Even though we're on the faceplace right now, it's not always the best source of information. Having a great relationship with your veterinarian and talking with them about what makes sense for your horse. For instance, we really like to use PRP in tendon injuries, tendon and ligament. So where Dr. Abbott was talking about doing an ultrasound guided lesion directly into, or ultrasound guided injection directly into a lesion, we will take blood from the horse, we'll pull it, we'll do some cool stuff with it. I like to say we do magic, we do some Harry Pottering. And when we're done, we have platelets and some other stuff in there because of what we've done. And platelets, if we remember, I think that's high school biology, but it might be college. I've had way too much biology in my life to remember at what stage this occurred. But platelets are what happen when you nick yourself, you start bleeding. Platelets are the first ones to the scene. They're like, on it, I'm here. First responder, you dialed 911, I'm here, I'm ready to go. And as a result of that, platelets start a whole cascade of things to say, okay, we have an injury, this is what we have, this is what we need, these are the resources I need to come to the area. So you guys, I'm here, I'm telling you, this is what you got to do. So by having platelet-rich plasma, we're recruiting all the other things we need. So it's often a really good choice. But really smart people have come up with other really great choices. And so we have stem cells. We have things that can very specifically target the first step of inflammation, which is IL-1, interleukin-1. So they make a protein that specifically goes to that interleukin and says, nope, you can't work. So it blocks it. We have all kinds of cool stuff like that now. And again, the trick is, I'll be honest with you, a lot of it is snake oil, and we need to be really careful that we're relying on the people who have the understanding to know which one is snake oil and which one is not, and not the Olympic show jumper just because he said so. So just putting my little aside there. Some other cool things that are coming down the road that are sort of not quite biologics, but not quite not biologics, are two products called Arthramid and Nultrex. And those guys are related to superglue, which you're like, why would I put superglue in my horse's joint? But if you think about the consistency superglue has when it first comes out of the tube before it sticks your fingers together, it's really jelly. And so those two products are versions of that we can put in the joint, and they stay there for years, which is really great, because some of the other problems we have is that just because we put a biologic in a place doesn't mean it's going to stay there. It might leave. And when we put a steroid in, it's definitely going to leave, and it's going to turn over and change, right? So these products, and again, those are Arthromed and Nultrex, when we put them in the joint, they stay there, and we know they stay there for prolonged periods of time. So for some of our really bad joints, we'll go to those because we have great efficacy for a long time, or we'll even combine it with some biologics, and then we can get all the fun of biologics with the long-term action of a super glue first cousin. Some other great treatments for a lot of lamenesses are Thyme. In fact, this is a component in our treatment for just about every lameness. And it's the most frustrating component because it requires patience, and I don't know a single horse person who's particularly good at patience. It's not really what we do. But it's really important that we start these guys off with some form of rest, and that may be complete rest with really bad injuries, but it's often a tiny bit of work in a very controlled environment. And as we all know, turning horses out is anything but a controlled environment. So it may be hand walking, it may be walking under saddle, it may be putting them into a controlled exercise program to keep those tendons and ligaments and joints doing the thing we need to do. But we're going to slowly ramp that up based on repeated imaging. And that's the advantage that we have. Let's say we do an MRI and we find a lesion. You're like, great. Now you want me to repeat an MRI in 4 weeks at $2,500. That's in this area. It is significantly more in other areas of the country. Not necessarily. At least if we know where it is on an MRI, we have a hope of going back and finding it again with our ultrasound sometimes if we are super targeted on where we're looking. Or we can look at our x-ray and see, do we have indications that the body is putting down bone in that area? And so the body is still experiencing inflammation. So we can use the information from that MRI to help guide us with where we're going in rehab. And then potentially, like if we're trying to take this horse back to high level performance, we may re-MRI at a much later date. But we're going to take all the information we gathered from all those imaging modalities and put them together into deciding, okay, your horse is now sound enough and we feel like the tissues are strong enough that they can tolerate walking. Now they can tolerate trotting. Now they can tolerate loping. Now they can tolerate your discipline-specific thing. So you can imagine it's one thing to walk, trot, and canter. It's another to go jump over a jump. It's another to take your carriage around a marathon course. It's another to ask your dressage horse to pee off or passage. So we start by putting the basics on, and then we start adding. Unfortunately, the last step is the chaos that is turnout. And we often do that with drug assistance. This is where better living through chemistry is a real deal, and drugs make your life easier when you start to turn out. And then there's some other stuff. And this is where the snake oil market is strong. There's a lot of other stuff out there. Some of it is valid, some of it is not. You better have a great relationship with your veterinarian when you're deciding on what of these to do, because some of the modalities are appropriate. We might be able to do acupuncture on that filly with the fractured neck. Like, she's got some muscle pain. You can imagine, I mean, if anybody's broken a bone, there's muscles around that bone and you get muscle pain as well as bone pain. So we can use acupuncture to modify her pain response. Not in a million years do we want to touch her with chiropractic. We run the risk with chiro of loosening that fracture and doing damage. So we as veterinarians are going to choose a modality that's appropriate to help supplement what this horse is getting. But there's massage, there's lasers, there's shockwave, there's vibrating floors, I mean, you name it, you guys have all seen it. It's all out there. Lots of it doesn't do a thing. So just be aware of that. And it's always good to go back to basics. So is your horse moving correctly? We're going to talk about that in a minute some more. But is your horse moving correctly? Are you doing all of the things your veterinarian said? And even though they said walk, you're not adding just a little bit of trot, because what can it possibly hurt? And walking's boring. It'll be fine, right? No, it won't. So following directions and not looking for the latest blinky red light thing from, Horse Weekly to fix what's going on with your horse, but going back to basics and doing basics well. So let's talk about preventing lameness, because we'd all like to not have to listen to this seminar and not have to deal with lameness at all, right? Can I have the one of the squishy pads? I'm going to put a tiny plug in for, it starts with all starts with the feet. Dr. Staples is going to talk about this more, but truly, no hoof, no horse. And one of the reasons that's a big deal in horses is we have this really long arm attached to this thing out here. And when this thing hits the ground and it doesn't do it in a proper fashion, all of those forces come up the leg incorrectly. So having a foot that is well balanced underneath the leg. So you guys can see this leg here on the left, the foot is way out in front, correct? So we're putting tremendous pressures on the backside of that horse. We're asking for that horse to have a deep digital flexor lesion as it comes around its navicular. We can do some things. We want to make sure that these feet in the middle are pretty darn good. So we want to make sure that the bottom of the foot is symmetrical. We want to make sure that the load bearing on the foot when we look at it from the side is really even and symmetrical. We can also do some things with the feet to make up for things that Mother Nature didn't quite get right when the leg didn't get put on straight. So there are some things that we can do, but looking at those in a very proactive way is really important. We certainly look at feet during every routine exam we do. I'll take a quick look at feet for every preventive exam I do. Every lameness we do here, I promise you that all of us start, not just Dr. Staples, but all of us start by looking at the feet and seeing how they're attached to the leg, seeing if there's things that we need to address with the shoeing. Is there something going on here that is causing pressure to be somewhere it shouldn't be? And it goes back to physics. It all amplifies as it goes up the leg. So the feet are really, really, really important. And June 16th is that seminar on feet. So everybody ready? Right now, write it down, June 16th, seminar on feet. Preventing lameness with fitness. Fitness is super important. If you are not fit, that's where you end up with acute injuries. So if you wake up in the morning and you decide to run a marathon, first you should question your sanity if you want to run a marathon at all. But you're not going to get very far before you have fatigued the muscles that manage your limbs, right? So you're going to fatigue, and then you're going to take a wrong step. You're going to stub that toe. You're going to land wrong you're going to roll that ankle. Horses are the same way. So being fatigued doing what they're doing is the number one place that we have really bad injuries happen. Chronic low-level injuries from not being appropriately fit, not having their feet done properly, and not being ridden correctly are the other places that we see all of a sudden that chronic injury. You got a little, and then they fall off the cliff. So all of a sudden you have this big injury that happens because those things haven't been done. So looking at your horse's fitness, not just for walking, trotting, and cantering, but what you do specifically. So for example, there's a really good study looking at show jumpers. And they found that if you use the same parameters that you use to look at is a racehorse fit, it doesn't apply to show jumpers. Because a racehorse, and they looked at racehorses and trotters, they need to do one thing, right? They need to sort of turn left, right, if they're in Europe, and go fast, right? Like that's all they have to do. But when you take a show jumper, you have to add repeated takeoff and landing. You have to add turns. You have to add rocking back on the haunches. You have to add all of these things to it. And if you only get them fit for speed, they are not fit enough to do show jumping. And the same with endurance horses. So if you look at, do they have endurance? They still don't have what they need to show jump. So looking at what your discipline is asking of the horses is really, really, really important, and figuring out the ways that you practice that. And this is something that really good coaches and really good veterinarians can help you do, is come up with those exercises that allow you to do what you need to do to have your horse fit for your specific discipline. But a little guideline, if you're just starting to work on fitness, long, slow miles, never a wrong answer. It's really hard to injure yourself walking. I'm sure we can. Don't doubt that. But thinking about adding miles, so like 2 or 3 miles of walking to your horse's life a day, 3 to 4 days a week, never a bad plan to add fitness. And if you're adding fitness, you can also take what you're doing for work and just add more walking. Around here in Florida, it's really hard to find hills, but if you can find hills to do that walking on, even better. And you get different things from uphill versus downhill. So finding up and down hills, really important. And then, like I said, finding those discipline-specific tests. If you're a racehorse, can you put on that burst of speed? If you're an endurance horse, can you go uphill at mile 55? That's really important. Show jumpers, we talked about piaffe passage. Oh my gosh, like the level to which they need to have the tendon and the ligament strength and flexibility to do what they do, and then the core strength to sit and do that. Like those are extreme strength tests, but they also need flexibility in order to handle it all. So thinking about what you're asking of your horse and coming up with discipline-specific tests. So a couple of easy ways to build muscle. If you want to watch these videos, they are on our YouTube channel. If you're a patron, like certain people in the audience, you've seen them before. But this is a TheraBand. And what it does is you can use them to pull, like you kind of pull them underneath the saddle. You can see they're clipped on there with it's a tarp clip and a snap. There's also a commercial system called Equiband, but you can also do this with TheraBand. You want to pull about 50% of the stretch out. And basically what you're doing is you're stimulating your horse as you're moving to just suck their core in. And who couldn't benefit from a few sit-ups in their life? We all could, let's be honest. See, there I am demonstrating. So it's putting pressure on the core. The key to this exercise is don't do a lot. I start literally with 5 minutes of walking because it'll make you sore really fast. We'll make them sore really fast. If you have any doubts about how sore it'll make them, give a try doing anything with a TheraBand on your body for just a few moments, and it will make you very sore. So I'm always really careful with this. But again, what this is doing is really stimulating them to pick up their belly, strengthen their back muscles, and do all the things that help them hold you and move and groove. You can also do it. There we go. You can also do one. Oops. Oh, maybe I did it on the next one. Haha. Yeah, nope. Never mind. 1 second. Don't you love the thumbnails that YouTube picks? Okay, anyway, you can also do it on the butt. So you can take another one and you can put it around here. And again, that just gets them to tuck for you. And I will start with one. I always start with this on the ground. So I put it on and then I walk with a halter and lead rope. I'll be honest, I haven't had a negative reaction yet, but I'm sure that one day I will have a very negative reaction to this going on. So I always start loose, just walking, make sure they're used to it. Then I tighten it, get them kind of used to it that first day of just moving around with one. Then I add a second one. And it does a great job adding a lot without adding a lot of time to your day, because if you're like me, you don't have a lot of time. Some other easy things we can do are balance pads. Can you see this? Okay, never mind that. So on the video here, I've got a horse standing on a balance pad. And these are just foam pads from Amazon. You can buy cheap to very expensive versions of these, but it doesn't really matter. What I'm asking him to do is stand there with both hind feet on it. And he is building up in a subtle way. He's building up his supporting structures for his hind limbs. So right now he's building the supporting muscles for his hips, his stifles, his hocks, all of that kind of, he's just building that literally just standing there. So the way that I use this at my house is I pull them out. I put them under back feet or front feet. You can do either or. Sometimes I'll do back feet. Sometimes I'll do front feet. I try to pick a limb that I'm doing for that week. So I'll do back feet 1 week, front feet another. And then I just stand on it while I'm saddling up. It's always interesting. You'll put it on a horse for the first time. You'll stand them on them and they'll like, woo! And they got to figure it out, right? And they're up there surfing. And then all of a sudden they're like, oh, got it. And they sort of lock their pelvis or their front limbs. And you know that they're working their muscles then. You can also see them if you look at them on the side when they're doing this. You can see them kind of flexing all these little muscles that help them hold. And I know Andrea knows exactly what I'm talking about. So the other way that I'll use this, and this is a, next one down. I've lost where I'm at. Okay, so this horse here has what we call a proprioceptive deficit. I'm going to replay that for you guys. So I have him, I'm putting him onto the mats. If you watch, when I pick up his hind leg, so I'm going to pick up his left hind leg, and he is going to do that right there, but with the opposite front. So with this horse, he has what we call a proprioceptive deficit, where he can't pick up his left hind without moving his right front. So here we go, watch. Boop. See how he set himself up for that, right? So he has that same proprioceptive deficit when I'm asking him to come down to a jump and set and jump, right? So by doing this on the balance pads, it trains them out of that motor pattern. Sometimes it takes a couple people, like it takes two people, one to pick up the leg, one to help them keep the front leg where it's supposed to be. But it's relatively quick to train one out of a motor pattern. And so I will just take note of this as I'm cleaning feet. So if I pick up a leg, you know, for him, he was most consistent on the left hind, that he would have trouble with the right front. So this horse is more susceptible to a right front injury because of the way that he sort of connected in his motor patterns. You can also add things. So like there, I had him on the front ones and I picked up a hind leg, and I'm asking him to think about where his legs are as well. If any of you have ever been through PT for a knee or a hip, this is often something they'll do, is make you stand on these to strengthen the muscles. And a lot of it is really good for proprioception. And Andrea can correct me when I'm done. All right, she says I'm good. We're good. The other thing that's really important is keeping them limber. So making sure that you're doing appropriate stretches. We have some really good YouTube videos as well, and on our Facebook for doing different stretches with them, and making sure that you are getting your horse even from side to side. They're bending to the direction they don't want to. I always do stretches after I ride. You get a better quality stretch when you have warmed up muscles. Did I get that right too? All right. Good job. So I do try to do my stretches after I ride so that I get a better group of them. We tend to recommend stretches based on how the horse is interacting with us when we do our lameness exams. We'll do just a good basic exam. And then we recommend which stretches would be the most beneficial for your horse from there.
Near the end of the horse's tail.
No, stop. All right. And then using modalities like acupuncture, chiropractic, we like a modality called functional electrical stimulation. These things are things that we use to keep them happy. We all have subtle things that are just chronically wrong with us. My right side doesn't work as well as my left side. We can discuss the times that I've been kicked that have led to that. But so me working on things all the time that keep my right side looser than my left side, because my right side is automatically tighter, helps me avoid lamenesses in me. But I don't really take care of myself because I'm me and I spend all the time trying to get the horses ready to go. But so doing those sorts of things for your horse, where you're identifying this is their weakness, we're going to do some things, like I said, like acupuncture, chiro, functional electrical stimulation, those sorts of things to help improve their weaknesses, helps us prevent lamenesses due to their inherent weaknesses. And then it's really important to have a good support team. This is so important. Having a good trainer or coach on the ground who makes sure that you are doing your discipline correctly. Make sure that you're moving in straight lines when you're supposed to be straight, that you're bent appropriately, that you're helping to formulate good discipline-specific tasks for your horse to do. All of those sorts of things. A really good support team is the number one thing you can have to prevent lameness. Good vets, obviously. Right here, you got that covered, no problem. You need a good farrier. As we said, no hoof, no horse. And you just need a good team of people around you to help you identify things that maybe you don't recognize about you or your horse. And then you need to listen to them. That's also important. So, okay, that was a lot. But lameness is a lot. And let's be honest, they're horses. They like to do lameness. So our takeaways are, number one, don't panic. Number two, A diagnosis is important because it helps direct us towards treatment, and it helps us determine how long we're probably looking at treatment, and how long we've got until, you're back doing your thing. We've got a lot of treatment options, working closely with your veterinarian and your support team to figure out which one is best for you, your horse, your lifestyle, your goals. All of those things is really important. And prevention is always, always, always your best bet. All right. How do I handle lameness in pregnant mares and foals? Okay, so let's go pregnant mares first. Typically with pregnant mares, we can actually manage mares with a lot of the anti-inflammatories that are on the market. Bute, Banamine, Equiox are all safe for pregnant mares. So we will work on, can we manage that mare through that with those products? The things we'll try to stay away from are steroids, although if we need them, we can actually get away with them in horses much better than we can in any other species. So we'll identify the lameness, and in many times we'll treat it just like we normally would. It wouldn't necessarily mean that we do anything different. The one place that we'll watch what we do is as they're getting closer to foaling, like really close, like a week to 10 days, then we have to be a little more careful what we do. But for the most part, mares are impervious to the fact that they're pregnant. And foals, foals. Foals are tricky because you can't really block a foal. You can't do a lameness exam on a foal. Have you ever tried to walk a foal in a straight line and trot it in a straight line? And that is chaos incarnate right there. But we have very specific things that typically cause lameness in foals. And so sometimes we will go to our diagnostics faster. For instance, foals, for whatever reason, like to break their coffin bones and their sesamoids. The cool thing about foals is just like small things of any species, they can do that and off they go. They never know they did it. So looking at foals, we'll go to some of those things that we know cause lameness. The other thing about foals that's really cool is we can do imaging we can't do in full-size horses. So where we can't image a pelvis in a full-size horse, I can lay a foal down and I can actually shoot x-rays of the pelvis, and I can't do that in a full-size horse. So we can go to some of that kind of stuff earlier. We can also CT a foal from tip to tail. And we can't do that in a full-size horse. So, does PRP work on new and old injuries? Does PRP work on new and old injuries? Yes. And one of the reasons is that PRP will go in and be like, come on, you guys are falling down on the job. I am here to say that we need to heal this spot. And here I am. It's the mass coordinator, right? It's think of like the level 1 trauma ER show that you watched. Like PRP is the one in there being like, all right, come on, let's do this. And so PRP works great for us on new and old. And in fact, it's one of the things that we'll reach for in an old injury, because sometimes it'll get the immune system and the body's healing factors to be like, woo, let's come along for the ride. We forgot. Sorry, we got busy over here watching the latest Marvel comic movie.
One more question, but
how much damage can thrush do in terms of causing a lameness? Thrush affected horses are usually sore. They can be very lame, but we can pick up the foot, identify that we've got thrush going on. And like I said, those horses are normally more what we would call foot sore than straight up lame. So they're either a little sore or they're dead lame and they're standing there not weight bearing. We evaluate them. We've realized that they have really bad thrush. That is where we'll say, okay, let's block the heel. And if we block the heel and it goes away, then we're going to say, okay, that thrush is more likely to be part of the problem. We'll move forward with treating the thrush and we'll go from there. You guys, did I answer? Oh.
one question. Maybe
You can have more than one question.
it may jump us down a rabbit hole, as you say, but
I love rabbit holes.
there's a particular horse I like to ride. Her name is Jackie O, and it's been described as serviceably sound.
Ah, the serviceably sound horse.
So how does serviceably sound differ from whether
Straight up lame?
Yes.
Yeah. So Jackie O is mine, so I can talk about her all I want. Lisa rides what we call a serviceably sound horse. And so the problem with Jackie O was that she developed inflammation in her tendon sheath. And we did all we could to shut it down very quickly. In fact, we do use steroids in there because we needed to shut down inflammation quickly. But the inflammation got out of hand no matter what we did. It calmed down over time. But in the process, the body, and especially the horse body, loves to overheal sometimes. And so it puts something in there called fibrin. And fibrin has a consistency of rubber bands. So she now has a rubber band that basically connects the back of her tendon to her tendon sheath. So it's one of those where she doesn't really hurt. And that's definitely where you have to have a great relationship with your veterinarian to know if it's one of those, right? So when she goes to move forward, she basically catches because she doesn't have, like, she's got that rubber band saying, nope, come back here, right? But as long as we don't move her past her range of motion that she has, you're not jumping around Grand Prix courses on her. So, she has a very specific range of motion that we say that she can do, and she's happy. She's also a horse that's very quick to be like, yeah, that was no. And so then we're like, okay, that's where her line is, and we're not going past it. And we respect that from her. There are some lamenesses that cause that, and a couple of the more common ones are like string halt. And those horses have what we call a mechanical lameness, where basically it just doesn't work right due to a catch, but it's not a painful process.
Like people, we could have sort of lameness
Yeah.
to our gait. And it's
I have no lameness to my gait. I'm serviceably sound. Yeah. But again, it's checking in with the horse, right? And that's where I always say, like, making sure that you are saying, all right, this horse, and a lot of our older school horses this applies to, right? They come out a little creaky, but they're perfectly happy to go shuffle around. It's making sure that you check in with your veterinarian periodically and say, okay, there's the line. Have I crossed it or haven't I? And we pay attention to the horses. And if they're being grumpy, if they're doing things that are out of character, we say, okay, we went across that line. But the best thing we can do for old crickety horses is a whole lot of a little. So that's my also general rule of thumb. I'm the same way, a whole lot of a little. All right. Are we?
No other questions in Facebook land?
All right. If you guys come up with questions, drop them down below. We'll do our best to answer them. You guys will be here to answer all your questions as long as you want.